Okay, so single contrast BE. I'm gonna set the control panel first, which is gonna be the Scout. So I'm gonna turn it on, get that going, 80 at 10. And then, according to the book, I would get the room prepped. I do have a BE bag in there, not mixed yet, so that would be good. I probably would not have the pad on the table if the patient, I wouldn't have the pad on the table, but just since we're practicing, I'll leave it on there for comfort. I'm gonna get my patient and then I'll go back in there and get that all settled. All right, Katie?
Yes.
Hi, I'm Lisa. I'll be your tech today. Can you confirm your last name and date of birth for me?
Shively, January 15th, 1987.
All right, great. Is there any chance at all today you could be pregnant?
No.
All right, and I'm sure you've gone through those 2 days of that god awful prep and been in the bathroom and probably hungry and tired and
Hangry.
weak and gotcha. All right, well, you're in the home stretch. What we're gonna do now is get you changed and then I'll bring you in there and explain everything, okay?
Okay.
What we need, I'll give you the gown, that goes on open to the back. You need everything off, shirts, bra, underwear have to come off, pants. Shoes and socks you can leave on for now, but I'm probably gonna have you at least take your shoes off once you're in the room and on the table. That gown goes on open to the back.
Okay.
You can put everything in your locker and when you're done, I'll come back and get you, okay?
Okay.
All right, thank you so much.
Don't forget instructions.
All right, so I'm gonna bring this in here and get this set up. Haha. Whoever was my previous tag probably didn't. You was. Good thing I don't teach English. All right, so I'm gonna get this ready for her Scout. .40" to the bucky, perpendicular, detent. Okay, move this out of the way for a second. Like I said, I would not have the pad on the table. I might for the Scout, but then I would remove it after that. All right, and I have my BE bag before she comes in. This is powdered barium. When I do go to fill it, I would fill it right here to 2,500 cc's with water, and then I would shake that. But I'll make sure her Scout comes out first. Katie?
Yes.
Come on in here. We'll let you have a seat up on the table there and we'll talk for just a minute. Oh, I didn't cover it. You're correct. You can you sit?
You want me to sit?
Sure. You can sit on the edge of the table.
Oh.
So we would not let her, we wouldn't really cover a little laundry bag, but we'd probably use a paper towel or something. All right. Yeah. So what kind of problems are you having that your doctor is having this exam done today?
Blood in my stool.
Okay. How long has that been going on for?
3 days.
3 days. Is it bright red or is it dark in color?
A little darker.
Darker?
Not like fresh, but not.
Okay. Kind of like coffee or tea colored or?
Yeah, maybe a little redder than that.
Okay.
Deep dark.
Okay. Any pain involved? Any pain in your rectum or in your abdomen at all?
Sometimes crampy pain.
Okay. But it's definitely rectal bleeding. That's what your doctor said, correct?
Yeah.
So you're seeing it in the toilet when you have a bowel movement. This probably didn't, the prep didn't probably help matters with that at all.
No, probably not.
All right. What we're gonna do, you can share anything else, but what we're gonna do is take one picture before we start, just to see what everything looks like in there. Make sure you followed your prep, everything's cleaned out. We're gonna take one picture to demonstrate that first, and then do you have any latex allergies that you know of?
No.
Have you had a colonoscopy recently?
No.
They don't have one scheduled for you that you know of?
No.
Okay. And do you still have your appendix?
Yes.
All right. Well, what we'll do is take that one picture, and then once we get that picture cleared, I'll go ahead and explain everything else to you, okay?
Okay.
We'll let you lie back on your back. Just so you guys know, if your patient does ever say that they have bleeding anywhere, coughing up blood, can you straighten your legs? Good. Is that all right? Ever, if they're coughing up blood in their stool, blood in their urine, typically your next question is always what color is it? And not being funny, but there truly is a difference between bright red fresh blood and dark blood. Typically, I think we talked about this before, but bright red usually indicates that it's fresh blood. Like rectally, it could be a hemorrhoid, could be a tear in the rectal wall. If it's darker in color, it usually implies old blood that can be coming from somewhere else. So we typically always ask what color it is if a patient states that they're having bleeding of any type. If it's like a laceration to the arm or something, no, not so much. But if it's internal blood, like bladder, rectum, coughing it up, anything like that. All right, so one scalp lengthwise would be central ray is iliac crest and midline. So iliac crest, midline right there down the middle of my finger. Left marker with a scalp annotated on there. All right, Katie, for all the pictures that I take today, what I'm gonna have you do is take in a breath. You'll blow it all out and then hold it out, okay? All right, go ahead for me, take in a deep breath. Blow it all out, hold it out, be good, breathe and relax. I'm gonna leave you here for a minute. I'm gonna go check these and make sure they came out, and I will be right back. So I would take this out, go check it. Assuming everything comes out good with this, then I would set up the room for fluoro. So I would move this down to the bottom just to get it out of the way, bring out the Bucky slot shield. I would prep this, but what I would do is finish telling her what I was gonna tell her. I'd move this out of the way, have the fluoro tower ready to come over, but not yet. What we're gonna do is, I'm gonna have you lie on your side in a minute, on your left side. I have an enema tip that I have to insert into the rectum, okay? I know with the prep, that's probably not the greatest thing that I can tell you right now, but what I'll do is put some lubricant on there. I'll put some lidocaine on there. What we'll do is you'll take in a breath, you'll blow it out. I'll insert that enema tip. Once we insert that, we do have a little balloon that we have to inflate to kind of help you hold it in there, because what I don't want you to do is push that out. Once it's in there, it'll kind of, you'll lose the sensation of feeling it so much. It'll just stay in there. We'll roll you on your back. The radiologist will come in. He's going to turn on the barium and let it go through. Now, when that happens, you might feel crampy just because everything's been coming out of there. You're empty. So when things get put back in, especially backwards like we're doing it, sometimes the colon has a tendency to spasm.
Okay.
If that happens, let us know. But the best thing you can do to help with that is to breathe in your nose and out your mouth slowly. I'm not going anywhere. I'm not leaving you. So anything at all, don't hesitate to tell me. And then worst case scenario, if you can't do it, we'll just stop when it's safe to do so. But otherwise, you're in the home stretch. Once this is done and the pictures are done, then you'll be good to go. Okay? Any questions you have for me? All right. Go ahead and roll up on your left side. So I'm going to put her in Sims position, which means she's on her left side with her right knee bent forward. Okay? And that just has a tendency by doing that to separate the gluteal folds naturally. Like, assuming, you know, they're not big booty Judy, then one cheek goes forward, the other cheek comes back. So I'm gonna leave you like that for a minute. I would mix this with 2,500 cc's of water. Once I mix it to where it's, you know, room temp or a little bit warm, not hot, I would shake that bag because it's a colloidal suspension. So I'd shake the bag really well, get it all mixed up. I'm gonna squeeze this little red ball that's right here to keep it, that's keeping it in. Let me undo that. Before I squeeze that though, I would have to move these clamps down so that I get the barium to come almost all the way down. So I would squeeze that up, the barium would flow to right here and then stop. Okay, I would have 2 pairs of gloves on my hands. Let me do that just to show you guys. Nope, I got it. I've been short all my life. Alright, so 2 pairs of gloves. Why did I say 2 pairs of gloves?
So you can take one off easily and throw another pair on.
Correct. Yep. So that I get one on and then I'll just waste one pair. I don't have to do both. So one on
do your nails have a pretty, like, decent effect for the, like, long nails?
Do they? If I was in the field, they wouldn't be this long, but no, I could probably pull it off.
Okay.
Now I can't because my fingers won't go in there. I probably wouldn't wear them this, I mean, smalls fit me, but I should want bigger. Alright, so 2 pairs of gloves on. Pretend I have them on both hands just so I don't waste them. Alright, this is all mixed up. I bring it over. The bag cannot exceed 24 inches above the table, which I told you guys. For me, 24 inches is about the top of my shoulder. So that's about where it needs to be. I would take this off of here. I would have lubrication, probably on a paper towel or something, some kind of gauze. I would put that on there. And then I would tell my patient, okay, I'm really not gonna do it, but it's gonna feel like I'm near there, so I'm just warning you.
Okay.
All right, what I'm gonna do, I'm not telling her this, I'm telling you guys this. Is this in your way? What we're gonna do is have her take in breaths. I always have my hand on the patient. I'm gonna tell her, okay, we're gonna breathe in, breathe out. Get her to do that for a few seconds just to relax. When she blows out and I'm going to insert, I'm inserting the tip. Basically, I would have tested this balloon too to make sure it's gonna work. I'm gonna insert, and when I insert, it's going up, and it's gonna end up curving naturally and going towards the umbilicus. Okay, so it's going up and towards the umbilicus, but I'm not thinking about that. I'm not doing anything differently. I'm simply holding it and inserting it when she breathes, okay? All right, so I'm just gonna move this gown by your legs. And I'm gonna have you put it between your legs. That way when you roll, they'll get to see how the tubing does that, okay? All right, so I would tell her, go ahead, take in a breath, blow that breath all out, and I would insert in and up and towards the umbilicus. She'd probably complain, but at that point, we'll just pretend it's there. All right, go ahead and roll back. Oh, my bad. I would insert 1 puff of air. That's all I'm allowed without having fluoro. So 1 puff of air in there. I'm gonna watch this to make sure this doesn't get tangled as well. And then I'm gonna tell her, okay, Katie, go ahead and roll on your back. Try and keep that between your legs if you can. Good. So now she's laying there. Now we can see the tip is right here. Okay, now granted it would be in her, but the only reason I want her to keep it there is so that you guys can see the tubing pretty much comes out under the leg. This I want to be mindful of, because if this is clamped and it accidentally gets stuck on the table and this comes off, guess what happens to the balloon? It deflates, and then we're in trouble. So you are keeping an eye on those 2 things. Once I've inserted that enema tip, I'm going to take off the top glove, but I still have another glove on both hands because we're pretending. All right. At that point, this would not be here. The radiologist would come in. I would give him his gown. I have on a gown. I'm going to stand over here, and I'm going to find my hemostats. And at some point, he's going to tell me, barium on. Nick, be my rad. Tell me barium on.
Did you just say it?
You say it.
Barium on?
Okay, barium on, and I'm going to take this and I'm going to move it to here.
Barium off. Oh,
Barium
I thought
off.
you said it first.
I'm the tech, you're my rad. So
Oh, okay. I thought I was the tech.
that's okay. So when
Sorry.
he wants it on again, he'll say,
Barium on.
and I unclamp and I say barium on, and then he says,
Barium off.
and I say barium off, and I clamp, and we go through that. Patients rolling. Now just try and keep that there, but roll for me, just so you guys can see what happens to the tubing. Roll. That's
Okay.
fine. You can roll whatever way you want. So if she rolls, do you see how this is moving? Okay. So I'm watching. I'm watching, trying to make sure that this doesn't come out. Does that make sense?
Mm-hmm.
So it's a pain. You can go back. It's not a pain for me, but it's hard on the patient, because if she gets it caught between her feet, it's going to pull it out. All right. So she would be rolling, doing all that. At some point, he's going to tell me to stop the barium, and he's going to say he's done for me to get my overheads. All right. So once we get to that point, I'm going to have her lie back on her back. My first image is my AP axial butterfly, which is a 30 to 40 degree angle cephalic. have to make sure that I'm lined up for this. Okay, so I've got 35 degrees on that, and then you can see light field is lined up right here. I need 9 over. I'll change this to while I'm here. This is gonna go to 125 at 3.3. 125 at 3.3, I'm pretty sure. So I are in central ray on this one. This is to straighten out the sigmoid colon. So I find ACES, which we haven't really had the need to find so far, but ACES is that bony protuberance on the front of the pelvis. So you've got iliac crest, follow it around right here, okay? ACES, 2 inches below ACES, which I'm pretty much there. So this line, 2 inches below ACES, and then midline, which is xiphoid. All right, and the whole point of this is to take the sigmoid colon that's right here and going all cattywampus to straighten it out. So I'm lined up there, I've got that, left marker. All right, same breathing for me, Katie. Taking a breath, blow it all out, hold it out, deep, good, breathe and relax. Now is AP, so I reset that to 110 at 1.7. I take the angle off and go to 0. Bring this back over. Align this. Grab my marker. This one is iliac crest and midline. Iliac crest. Right there, midline right there, left marker, same breathing, taking a breath, blow it out, hold it out, be good, breathe and relax. Now comes RPO and then LPO. All right, so what I'm gonna have you do is scoot towards me just a, actually I lied, scoot away from me a little bit. Good, bend your left knee. Bring your right arm over to your, I'm sorry, your left arm over. You did what I needed you to though. Roll towards me. Good, lay back against that. This is a 35 to 45 degree oblique. Straighten that out. Good. And this one is level of the iliac crest, which is right there. Iliac crest. And then you find midline, which is xiphoid, and it's 1 inch up from that. Okay, so 1 inch to the upside. And the purpose of this one is gonna open, the RPO is gonna open the left splenic flexure. So I leave the marker, I leave the collimation open still. This is still left side, so left marker. Go ahead, take in a breath. Same technique, 110 at 1.7. Blow it out. Hold it out. Be good. Breathe, relax. All right. I'm going to take this out. Let you lay flat. Slide towards me if you would. Good. Bring this arm over. Bend this knee. Roll up away from me. Good. Lay back against that. You can straighten this leg out. All right, iliac crest, and 1 inch to the upside. So xiphoid here, 1 inch to the upside. So xiphoid, inch up. Left marker still over there. This one, the LPO is going to open the right hepatic flexure. Same breathing for me, Katie, taking a breath. Blow it all out, hold it out, be good, breathe, relax. This next one is going to be the lateral, and I believe it's 110 at 20. And this should really be at 40, so I'm like an inch too low, which probably is not a huge deal, but all right, go ahead and roll up on your left side the way you're headed. Good, knees and ankles on top of each other for me, and your shoulders back towards me. I need her straight on this, so back straight, that's good. All right, and this one I collimate to 10 by 12 lengthwise, so it's 12 long, 10 wide, because I know you guys sometimes struggle with that. All right, and this one is at the level of ACES, which is right here, like my finger, my middle finger is right on her ACES. So I need that line at ACES and mid-coronal. Mid-coronal, right down the middle. All right, and that would get her rectum, not being creepy, but her backside is here. Rectum is probably like, her anus, I should say, is probably right about here. So then the rectum is gonna come up. And remember, this looks smaller than what it's really gonna project. So you're trying to get the rectum coming up and then going up the descending colon. So that'll be in there, and then I can do left marker. Left marker right about there. She's straight, that's still in, that's collimated. I'm set at 110 at 20 mass. Taking a breath, blow it all out, hold it out, be good, breathe and relax. Now you can stay just like that, get comfortable. I'm gonna go check these, make sure they came out, and I will be right back. So I would take this, I would check those images, make sure everything looked good. If it looked good, I'm gonna come back in, I'm gonna tell her, okay, Katie, what I'm gonna do, I'm gonna move this out of the way for a minute. I'm gonna drop this barium and I'm gonna let it drain. Don't do anything different, just lie there, be comfortable, and know that some of that's gonna come out. So I would drop this down. I would let it drain into that. You're gonna start seeing barium trickling back into here. I'm just gonna lift it off her foot right there. Trickle, 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 drain, drain, drain. She's doing good. At some point, when it's just trickling and there's no more, I'm gonna tell her, okay, Katie, I'm gonna deflate this balloon and take this tip out, and I'm gonna let you get up and come into the restroom and try and empty as best you can, okay? All right, so I would take this off. This gets saved. I would tell her, taking a breath. I would slide this out. That would ideally go in the garbage can. I would have her sit up. You can sit up if you want. And I would tell her, okay, I'm gonna bring you into the restroom over here. You go ahead and sit in there, drain as much as you can, and I'll come back and get you in just a minute. Just open the door whenever you're ready. Okay? All right, so she's going in there, she's taking her time. I'm taking care of these two things that I didn't throw away. I'm setting up for her post image, which means I could put the IR in here. I could set this back to 110 at 1.7 or 110 at 2. While I'm waiting, at some point she'll finish, she'll wash her hands, she'll come out, and I'm just like, do you feel better?
Yes.
All right, we're gonna get one more picture just to show how well everything emptied, and then I will check that, and if that's good, then you're good to go. All right, so, oh, well, you're in the home stretch. Hopefully they figure out.
Taco Tuesday?
Yeah, it is Taco Tuesday. I'm not sure after all that prep you really want tacos, but.
I'll get them less
I'm always down for tacos.
Thank God.
Alright.
I'm good for lunch.
So post is iliac crest and midline.
Hang out with
Not sure why you're huffing and puffing. She's the one that just had the BE.
I have to watch it.
I have to watch it.
That would have a left marker with a post evac on there. Excuse me? Shh. That would have a left marker with a post evac. Back open to 14 by 17. So I would tell her one more time, take in a breath, blow it all out, hold it out,
B.
Good, breathe and relax. All right, I'm gonna check this. If this is good, then I'm gonna get you up, give you some post instructions and send you on your way, okay?
Awesome.
All right, so I'm gonna go check that. Perfect. I'm gonna move. Awesome. Okay, so that looks good. I'm gonna move this a little bit to make getting up a little easier for you. All right, we'll let you sit. Now, what we've done, I'll let you sit there for a minute. We put quite a bit of barium in there today. You did get most of that out, which is awesome. But what we'll do is over the next few days, I want you to increase your fluids, specifically water. You want to drink 8 to 10 glasses of water on top of what you normally drink. For the next day, couple days, you're going to notice that when you have a bowel movement, it's probably going to be white. That's perfectly normal. We want that to come out. Once your stools go back to a normal color, you can stop the extra intake of water.
Okay.
All right. As far as diet, you can resume your normal diet. Any questions, follow up with your physician. He'll probably get the results in 24 to 48 hours. All right. Anything for me?
I don't think so.
All right. Then what we'll do is let you come back and get dressed. And you'll notice, and I'll walk you out in just a minute. You'll notice I didn't shield on anything.
Can.
You can on some, probably not on her, but I am telling you straight up with the amount of moaning and groaning that's going on, you're probably not going to shield. If I knew that, you know, I don't know, when they're younger, I would attempt to, but it's almost more of a pain than it's worth. Females, yes, the ovaries get in the way. Males, I would like to say I would attempt to, but honestly, it's a pain because they're usually very, very miserable and they're moaning and groaning. How much longer? Are we almost done? I can't hold this. I'm going to lose it. I got to go to the bathroom. And you're just like, whoa, and you're trying to get everything done and not have that. So I didn't shield. I'll be honest with you. I probably wouldn't in the field unless the patient was super agreeable and easy, then I would attempt to, but I'm just being honest, it's harder to do than to not do.
You bet.
All right,